Here's my Pickeringsburg ID. Okay. You were a nurse, a good one at that. But one day, you walk in to see one very healthy patient on their deathbed at one night's time. This is someone's grandparent, mom, dad, family member. This is someone they loved. And someone who, as they grew old, made so many memories with. My name is Brooke Brakovich, and I've worked in nursing homes since I was 15. I've seen every single thing possible in healthcare, and while most of it's amazing, a small quarter of it is something that really haunts you forever. The way that nurses and patients themselves are treated, there's pros and cons to both. Nurses are burnt out and expected to do more than they can handle. And sometimes the residents are ungrateful, but at other times they are right and they do deserve more. We as people who will eventually grow old ourselves, we want to have us and the older generations, as we become old, treated with the most respect. Today, I will inform you about death rates in nursing homes, everyday routines as nurses in nursing homes, and nursing burnouts. First, I will be speaking about death rates in nursing homes and how that affects nurses. This article by Pub Central says, yearly mortality rate throughout the 3-year observation period was 31.8%. This quote is a horrific fact I read because 31% of residents die each year in a nursing home. Obviously, this isn't in every nursing home, but this is the majority. If this number does not haunt you, then I don't know what will. It's also mentioned in an article by Robert J. Brent that a research question that is then, how have some nursing homes been able to effectively protect the residents while others not? He is stating here that maybe some death rates are lower than others due to better working conditions, but the problem is the statistics as a whole. As nurses, we have to be better at taking care of our patients and moving on if our favorite resident has passed away, because some of these things are out of our control. Now that I've told you about death rates in nursing homes, I will tell you about everyday tasks. So, as I said before, I've been working in nursing homes since I was 15 years old. I've seen anything you can imagine. It is kind of hard to sum up specific routines, but I did find some sources that are a little bit better at explaining it than really I can. Here's one. Generally, the resident's day starts at around 5:30 or 6 in the morning. This is the time when the CNAs, the nurses, or certified nursing assistants, the PCTs, begin getting the residents out of bed. Many residents will assist in abluting and getting in and out of bed, and many more will need help getting dressed. So a nurse's job always starts early. 5:30 or 6 in the morning is where the nurse's day starts, and sometimes their day doesn't end until 7 p.m. at night. A lot of nurses will work 12-hour shifts, and their day will consist of many tasks. The role of an assisted living faculty nurse is not always what meets the eye. And a day in the life unfolds with balance among medical expertise, compassionate care, and furthering their education on the latest practices and procedures. The nurse is responsible for all their medical staff, their unit that ensures their responsibilities are being executed, also while bending and lending and helping providing this team and support that they and their team needs. In this article, in that quote, you can kind of infer what seems like a simple routine actually consists of a lot more factors, which leads to my next point: nursing burnt out. So as a nursing student myself, I'm currently stressed, and I do seem to get burned out from time to time. The medical field is no easy task. Since the pandemic began, Early in 2020, concern has grown about healthcare professionals experiencing compassion, fatigue, and burnout, which can impact retention and well-being. These issues have been well-known challenges in the medical field for some time, especially in pediatric intensive healthcare units, where nurses and physicians can report anywhere from 42% to 77% burnout fatigue. Around 100,000 nurses left the workforce during the pandemic, increasing already worrying more burnout trends. I can myself attest to the fact that since 2020, COVID-19 has affected us all. And in mostly nurses, it has shown the most burnout. But in a positive tone, there's also people working towards this. I did find an article that quoted, across the United States today, true heroism is displayed by our healthcare professionals, from the wounds and illnesses they treat to the compassion that they show each patient. Healthcare workers decide their lives to improve the quality of life and devising safer, more effective care programs for patients of all walks of life. As the nation continues to navigate the unprecedented and profoundly devastating effects of COVID-19 pandemic on the medical system, healthcare workers remain on the front lines, committed to providing their life-saving care and support to those who need it most. This is a great article because we have to change our ways now when our generation gets older, so everyone is treated with respect. In conclusion, these points need to be addressed. Whether it is nursing burnouts, death rates, or everyday routines, nursing death rates are way too high in the nursing homes. And everyday normal routines for nurses can be very overwhelming and also lead to higher nursing burnout trends. All these start from the nursing home itself and also in the hospital and how we organize to take care of our residents and our patients. We need to better prepare everyone for the future and current older generation and take care of everyone in the best way that we can.